North Carolina. Dr. Mandy Cohen is that state's health secretary. Dr. Cohen, it's good to have you with us this evening.
Thanks for having me.
Tell us how you're thinking about this reopen, and is the state ready?
Yeah, so we've done, I think, a very good job in North Carolina, and we have truly slowed the spread of the virus and flattened the curve. We are at about 12,000 total cases, 470 deaths total. And so we've been looking at 4 key metrics to tell us should we open and when should we do that. We've been looking at them very publicly. We announced them a number of weeks ago. Folks could follow along. And what we're seeing is stability in those metrics, things like the number of cases and testing, how we're doing with hospitalizations, our surveillance data. And so we announced yesterday, Governor Cooper did, that we will be moving forward with a phased reopening. We want to do it in a measured way. So we are starting with lower risk activities, things like opening up non-essential businesses, so bookstores and jewelers and clothing stores and such. Opening up parks so folks can get outside. It's beautiful here in North Carolina. So we're moving forward with that, but we want to do it in a measured way and keep letting the numbers, the data, the science guide us.
How long do you wait before you go to phase 2?
Right now, we say about 2 to 3 weeks. We know that the first activities that we're taking are lower risk activities, going to retail establishments and such. We are really focusing on folks doing 3 things when they leave their home to shop. We want them to do the 3 W's, we're calling it: wash, wear, and wait. We want them to wash their hands. We want them to wear face coverings, and we want them to wait 6 feet apart. So we think if we can pair those with some of these low-risk activities, we hope to reassess our numbers in 2 weeks and then move forward with other kinds of things like reopening of bars and of nail salons, hair salons, and those kinds of activities.
You worried at all about a spike of cases as you start to reopen?
And certainly, we're going to watch the numbers closely. I think we've done a great job pulling together as a state to slow the spread of this virus. But I think if we can stay focused on these activities of keeping everyone as protected as possible, again, our 3 W's, having our businesses work together to make sure they're protecting employees and customers. We have a lot of guidance on how to do that. I think that we can do that. Look, we know the virus is going to be with us. We don't have a vaccine. We don't have a cure. So this is about how do we all learn together and work together to keep the virus spread low while we get back to the things that we love.
What's the current state of testing in North Carolina?
Yeah, we've been very aggressive from the start. We've done about 164,000 tests since the start of this. We're the 9th largest state, a little over 10 million people. I still want to see those numbers go up more. We've actually doubled the amount of testing we've done since just a few weeks ago. So we're doing about 8,000 tests a day, but we want to see that go up even more. So, we have a full testing strategy like many states. We think it's foundational to us being successful and being able to identify folks with COVID-19 quickly, to isolate them, understand their contacts, get them tested. So that is certainly a foundation of our strategy.
Are you using any other states as a guide on either what to do or what not to do? Those who have gone before you, opened businesses that maybe now you would say that maybe that was a mistake in those states and that's why you're not doing it. I'm using, salons, gyms, things like that as an example.
Yes, well, we tried to look at the data that tells us indoor activities where you're in close contact with people spread the virus more. So, we're really trying to look at the science and the evidence. It says that the virus spreads more, something like 18 times more in indoor and close contact settings. So that was really what was guiding us in terms of what happens in the first phase, what happens in a second phase. I think a number of states are very similar to this. I certainly am looking at some of my colleagues in Colorado that I think are maybe like a week ahead of us in terms of giving guidance that seems like a very phased approach. But I have a neighboring state like Georgia that is also trying to reopen much more quickly. They're on our western border. So we're very much watching what Georgia does so that we are protecting folks in western North Carolina as well.
Dr. Cohen, appreciate your time so much tonight. Be well and good luck.
Thanks for having me.